Thank you once more for joining me. In this session, we're going to talk about two things. Number one, how to recognize cardiac arrest. And number two, how to perform cardiopulmonary resuscitation. So how do you identify that an individual is in cardiac arrest? Three things to look out for are: number one, is the person unresponsive to calls and to touch? Number two, is there absent breathing or there is abnormal breathing? And number three, is there an absent pulse? Once you can establish that these three things, then you can safely say that the individual is in cardiac arrest. Now, how do you perform cardiopulmonary resuscitation? First and foremost, you must ensure safety of the environment in which you are in for both yourself, the victim, and other bystanders. Before you take any action, you must ensure that the environment is safe for all of you. Having established that the environment is safe, the next thing to do is to check if the individual can respond to you or not. And how do you do that? You kneel by the patient's side, gently touch the patient's shoulder and give him a gentle shake. If there is no response, call out to the patient. If you know the patient's name, you can call his name. If you don't know the name, you can just call out to the person. Are you there? Hello, can you hear me? Talk to the patient and touch him gently. Having done all of this, if the patient is still unresponsive, then you move to the next step, which is the airway. You want to make sure that the airway is patent. You want to make sure that the airway is open. And how do you do that? You do that by placing your hand on the patient's forehead, then using the tips of your fingers of the other hand to gently lift the point of the chin upward. By so doing, you open the airway. Once that is done, the next thing to look out for is the breathing. Is this individual breathing, or is he having abnormal breathing? And how do you do that? You do that by looking. You look at the chest. Is it rising and falling? If there is no movement, then you want to listen. Can you hear any sound? Sounds of individual taking in breaths, can you hear anything? If that is not there, then you want to feel for the breathing. You bring your hand close to the nostrils and see if you can feel anything. Now, if you have established successfully that this person is not breathing, then you want to call for help. The next step will be to start a chest compression. In this case, you put the heel of your dominant hand on the patient's sternum, that is the lower chest, the lower part of the breastbone, the sternum. You put the heel of your dominant hand on the sternum, then you put the heel of your second hand over the first hand, and then you interlock your fingers. Once you have done that, you position yourself vertically over the patient's chest. Then keep your arms straight, keep your elbows fully extended, and then you commence your chest compression. Now, these chest compressions will be done by giving 30 chest compressions and then 2 rescue breaths. Now, 30 chest compressions, as you go down on the chest, it is advisable that you can go as far as 5 cm deep, but not more than 6 cm deep. And once you give the first chest compression, you must always allow for a chest recoil, and then you go again with the next one and allow for a chest recoil. However, your hand must still remain on the patient's chest. Having given 30 chest compressions, if you are trained for it, the next step will be to give 2 rescue breaths within less than 10 seconds. To give 2 rescue breaths, first of all, you pinch the soft part of the individual's nose to keep the nose closed. Then with your fingers touching the point, the chin, you lift the chin up, make sure the mouth is open, take a normal breath, and then cover the individual's mouth with your mouth. Make sure it is airtight, and then you breathe into the individual, your expired air. If you haven't given the 2 rescue breathing, you go back immediately to chest compressions. So the chest compression and rescue breathing must continue in the ratio of 30 to 2 until expert help arrives. However, if you are untrained to give rescue breathing, then you must, or for some other reasons you are unable to give rescue breathing, you must continue your chest compressions alone until you get 100 or 120 compressions, and then you start again. When giving this cardiopulmonary resuscitation, the patient may recover. Signs of recovery may be that there will be establishment of spontaneous breathing. The patient may open his or her eyes. There may be movement. Now, when all of these are noticed, then the patient is recovering. However, if the patient is still unresponsive, but spontaneous breathing has returned, then you can stop the chest compression and put the patient in what is called the recovery position. If there are no pointers to recovery or signs of recovery, because it is not at all times that patients may recover following cardiopulmonary resuscitation. So if there are no signs of recovery, you continue your cardiopulmonary resuscitation until expert help arrives to take the patient to a health facility. And such an individual must be carried in a safe manner into the ambulance and conveyed to the hospital. Thank you very much for listening. Together we can heal the world.